In this video, we will look at a few dosage calculation problems when a nurse has to calculate drops per minute when the nurse is setting up a manual IV set. Here's our first problem. Order: infuse 1,000 milliliters of normal saline over 3 hours using a 15 drops per milliliter set. How many drops per minute will the nurse calculate for that? And we will be rounding to the whole number. I'm going to introduce a formula here for you. Volume over time times your GTTs, which are always given in the problem. Volume has to be in milliliters. Time has to be in minutes. So remember, volume over time times GTT. And you have mLs here and minutes here. M, and M. Volume is given in liters, you have to convert. If time is given in hours, you have to convert. So let's plug in our numbers. Our volume is 1,000 milliliters. It's already in milliliters. We don't need to do anything. We're going to leave it just like that. Our time, however, is in hours. 3 hours. We need to convert it to minutes. There are 60 minutes in an hour. 3 times 60 will give us our hours. Volume over time times GTT. On your calculators, if you calculate, you're going to get 83.333. We're rounding to the nearest whole number, which is 83 drops per minute. And that is how you solve these type of problems where we have to calculate manual IV flow. Volume over time times GTT. Now, in this problem, the wording is a little different, but we're using the same formula to solve it. Let's take a look. Order normal saline going at 225 milliliters an hour for 8 hours. And the drop factor of our manual IV tubing is 15. So find drops per minute that nurse will calculate for that manual IV rate. Using formula volume over time times GTT, volume is 225. Now, what is our time? There's an hour here and there's 8 hours here. Which time do we use? We need to use time that's associated with our volume. So 225 milliliters are going over 1 hour or 8 hours? It's going over 1 hour. That's the time we must use if we are using this volume. 1 hour. There are 60 minutes in an hour. Times our GTTs. We get 56 GTTs per minute. Here's our next problem. Order: infuse 3 liters of D5W over 24 hours at a rate of 125 milliliters an hour. Calculate drops per minute if the set used delivers 60 drops per milliliter. Again, we're using the same formula, volume over time times GTT. Remembering that volume has to be in milliliters. Time has to be in minutes. However, what volume and what time do I use? There's a bunch of them given here. We have this volume, we have this volume, we have this time, and we have this time. So remember, in the previous problem, I told you volume has to be associated with your time. If I use 3 liters, I'm going to use this amount of hours because 3 liters are going over 24 hours. If I choose to use this volume, I'm going to use this time with it. I can use either one in this particular problem. I'm choosing to use this one first. I'll show you with the other one as well. So let's say I want to use 125 milliliters per hour. I'm going to set it in my formula. Milliliters are already in milliliters. I have nothing to convert. Divided by 1 hour, which is 60 minutes. I'm converting my time to minutes. Times, what's my IV set? It's 60 drops per milliliter times 60. That gives me 125. I found this using this volume and this time. Now, this time I'm going to use this volume and this time. Let's see if it will give me the same answer. 3 liters, I have to convert to milliliters. 3,000 milliliters over 24 hours. 24 times 60 is 1440. Now I need to time it by 60. And I still get 125 drops per minute. Here's another problem. Order, infuse 0.9% sodium chloride, 100 milliliters, over 15 minutes, and the drop factor is 20 drops per milliliter, and we need to find drops per minute to set on the manual IV set. Once again, we're using the same formula, volume over time times GTTs. And remember, volume is in milliliters, time is in minutes. Where's our volume here? 100 milliliters we're infusing. Going over time in minutes, it says to go over 15 minutes, nothing to convert. We're already in minutes. Times our GTTs per milliliter that are given. Equals 133 drops per minute. You see that sometimes there's nothing to convert, and don't be questioning this number here. It is just the name of the fluid. There's no percentage that you need to be calculating or anything. This is just your normal saline. 0.9% sodium chloride is the same as to say normal saline. Some students get confused. Do I need to use these percentages in some kind of calculation? No, you don't. Just identify your volume, identify your time, make sure top is in milliliters, bottom is in minutes, and plug it into the formula. That's it. More practice problems in my book, Dosage Calculations, Getting It Right Every Time, straightforward, always accurate method for nursing students.